Over the course of just 3 months, a new infection, an infection with a new viral strain that had never been seen before, went from a single case in a fish market in China to thousands of confirmed cases in countries around the world. The United States Centers for Disease Control says that the continued spread of the virus is inevitable. It's no longer a question of if this virus is going to strike your community, but when. Fortunately, most cases are mild. We will get through this, but there are things you need to know to prepare for what's coming. Before we dive in, a quick disclaimer. Though I am a doctor, I'm not your doctor. I'm talking here about general information and advice, but I don't know anything about your personal health history. If you have specific questions about your own health, talk to your own physician. We'll start where it all started, in a noisy, crowded market in the city of Wuhan, China, in early December 2019. This is a so-called wet market where meats, poultry, and fish, along with more exotic animals like bats, turtles, and all sorts of wild game, are often displayed live, squawking and swimming, to potential customers, then slaughtered and sold. According to city authorities, sanitation was terrible, with carcasses and wet garbage piled up alongside food. And somewhere in there, between the terrified animals, their waste, and their human handlers, a virus later named SARS-CoV-2 made a leap from an animal infection to a human infection. By the way, the first part of the name, SARS, there's a reason that sounds familiar. This has happened before, with an earlier virus that emerged in 2002 named SARS-CoV. That virus caused a severe pneumonia that was often fatal, but didn't lead to a widespread outbreak. This time, luck may not be on our side. The market happened to be near a train station and was in a busy area in a middle-class business district in a city of 11 million people. This newer virus, SARS-CoV-2, didn't stay in that wet, noisy market. We don't know exactly who that first patient was, this first person to catch the virus. We do know that by the end of the month when this infection first appeared, authorities from Wuhan notified the World Health Organization of an unusual cluster of severe pneumonia of unknown cause. An initial study of 41 patients showed that most of the victims had direct contact with that wet market in Wuhan, 27 of the first 41. But 14 did not, which was an early clue. From the onset, people were coming down with this infection without having direct contact with animals at the market. They had to have been catching it from other people. The chain started with the animals. It was probably a bat, but transmission from person to person had already begun. On January 1st, 2020, police closed the market. Within days, the cause was identified as a new or novel coronavirus, a new member of a family of viruses that usually causes just a simple common cold. Though draconian quarantines and limitations on travel were instituted, the virus continued to spread to a cruise ship off the coast of Japan, through a megachurch in South Korea, and to a major religious site in Iran. And it's continuing to spread despite quarantines and travel bans. Though almost all cases initially occurred in and around Wuhan, we've now reached the point where the daily count of new cases is higher outside of China. Whatever hope we had of containing the virus within China or of keeping it from spreading across the globe, that's not going to be possible. It's time to be realistic about the best way to deal with a global pandemic of this new disease. The main symptoms caused by the new coronavirus are very similar to influenza. After an incubation period of probably about 6 days, maybe as long as 14, there may be a phase of fever and aches, followed by coughing and sometimes shortness of breath. Other symptoms can include sore throat, headache, and diarrhea. But what we really don't know is how often these symptoms occur in infected individuals. At first, the only people who came to medical attention were very sick people with pneumonia and serious respiratory symptoms, many of whom ended up in the hospital. But it's become clear that some people have mild symptoms, perhaps no worse than a common cold, and some people, especially children, may have no symptoms at all. Even without symptoms, people infected with this virus are still contagious and can unknowingly spread the infection to other people. The infection itself has now been named COVID-19, short for Coronavirus Disease 2019. Based on early reports, it's thought that about 20% of people with COVID-19 will have severe pneumonia requiring hospitalization, with an overall mortality rate of about 2%. The illness is much more severe in older people and those with pre-existing health problems, who have accounted for most of the deaths from COVID-19. These rates are probably overly pessimistic numbers because they don't account for the large number of people with milder symptoms who haven't been tested for the virus. Still, the true rate of hospitalizations and serious illness is probably higher than that of influenza, which causes about 500,000 deaths a year worldwide. We've had new coronaviruses before. SARS in 2002 and MERS in 2012 were both new infections, and both of those also originated from animals. But those both seem to burn out without causing worldwide health problems. COVID may end up following a different trajectory. With SARS and MERS, victims quickly became too ill to travel and work and didn't spread infection easily. The frequency of mild COVID cases has already led to far greater numbers of infections in a much shorter time and has made complete containment impossible. It's also clear that some people become contagious with this new virus even without any symptoms at all. I used the word pandemic before. A pandemic is defined as the efficient transmission of a disease spreading widely outside of its origin. We're past the time when containment can separate us from them, the contagious people, from the rest of us. Too many people have already, unwittingly, brought this infection to too many communities across the globe. And there is no way to reliably know exactly who, in a crowd of people, is likely to be contagious. Quarantines cannot be effective because we simply cannot tell who needs to be quarantined. But we can protect ourselves and our families by taking other simple steps. As individuals, we need to commit to decreasing the rate of transmission. If you're sick, stay home. If your children are sick, keep them home. Though children have milder symptoms, they're probably a significant source of infectious spread. Schools and businesses need to re-examine policies that punish sick days and need to build in more flexibility so people can stay home to care for their families. If symptoms are mild, like ordinary cold symptoms or a mild cough and fever, it is best not to visit the doctor. COVID is a viral infection, and there's no specific treatment or antibiotic that will help. Traveling outside for any reason exposes other people. Of course, you should seek medical attention if you experience shortness of breath or more severe symptoms. During a local outbreak, avoid crowds, and of course avoid people who are coughing or sick. The transmission of the virus that causes COVID-19, and actually the transmission of influenza virus and many other respiratory viruses, almost always occurs via large droplets, coughed or sneezed, and then left on surfaces. So if you're sick, don't cough or sneeze on your hands and then touch things. Use a tissue or sneeze into your own elbow. If you do cough on your hands, wash or sanitize them before touching anything else. And washing hands is also crucial for the rest of us too, even when we're healthy. If you touch a contaminated surface, say a doorknob loaded with virus, it will not make you sick as long as it's just on your hands. You can spread it around, but you won't make yourself sick unless and until you touch your own face with your own contaminated hands. Respiratory viruses cannot get through your skin, but they can infect you through the moist lining of your nose, eyes, and mouth. So, if you wash your hands frequently, you're less likely to infect yourself when you offhandedly rub your nose. And bonus, you're less likely to spread infectious material to more surfaces and to more people. An effective hand washing can use any kind of soap. It doesn't need to be a special antimicrobial product, but it does require at least 20 seconds of scrubbing. Here is Perhaps the most important and overlooked tip, probably the single most important habit for you to learn to prevent yourself from catching any respiratory infection. Never touch your own face with your own hands. If you must rub your nose or eyes, wash your hands first. As an alternative to washing, alcohol-based sanitizing liquids work well. Splash a little on and make sure to rub your hands and let them dry off before touching anything else. Those are the most important personal steps to take. Isolate yourself if sick, wash your hands, and don't touch your face. People often ask about masks, but the evidence is clear. For healthy people walking around in public, wearing a mask does not help. Now, a mask is a good idea if you're in a room caring for someone who's sick. And a mask is definitely a good idea for people sick with COVID themselves to wear. That protects everyone else. If there is someone sick in your household, try to isolate them in their own room and have them use a separate bathroom if possible. Be especially careful about hand washing and consider using gloves. But gloves themselves get contaminated too and need to be changed before you touch your face or spread the infectious droplets to other areas of your home. Eye protection and gowns are important for healthcare workers, but less practical for home use. As communities, other steps may be needed as this outbreak unfolds. Though quarantines don't work, temporarily closing workplaces, schools, and public venues that attract crowds may be necessary. If your community is hit hard, it will be best to stay home. So make sure you have a few weeks of essentials like food, medicine, toiletries, and cleaning supplies. At this point, as I'm recording this, it does not seem likely that we're going to contain this new coronavirus. It's become too widespread too quickly, and people are spreading the virus even when they don't know they're sick. Now, we may get some good news. During the summer months, fewer people get sick with respiratory infections, so maybe that will slow coronavirus's spread. It's also possible that a vaccine or antiviral medicine can be developed, but I think it's best to be ready. If we work together and do our part, we can protect our communities and our families. It's not time to panic, but it is time to prepare.